Hello and welcome. Let's talk about histamine. So, what are autoquotes? Autoquotes are the substances which usually have short half life, act near the site of synthesis, and usually reach the site of action locally but not via bloodstream. The autoquotes are histamine, bradykinin, 5-HT or serotonin, eicosanoids like prostaglandins, thromboxane, and leukotrienes, and platelet activating factor. Now, histamine was synthesized in 1907. It is an endogenous basic biogenic amine and histamine receptor agonist. The chemistry is 2,4-imidazoyl ethylamine and it is a decarboxylated amino acid. It is a hydrophilic molecule comprising of an imidazole ring and an amino group connected by methylene group. Sources: it may be animal, plant, or snake venom and secretion from insect sting. Mast cells like a nose, mouth, feet, internal body surfaces, and body vessels. Non-mast cells like basophil, platelet, brain, and enterochromaffins like cells of epidermis. Now, synthesis. Histamine is formed by decarboxylation of amino acid histidine catalyzed by enzyme histidine decarboxylase. Pyridoxal phosphate is required as a cofactor, and once formed, histamine is either stored or rapidly inactivated. This is a picture showing the synthesis of histamine. Now, storage. Most histamine is stored in cytoplasmic granules of tissue, mast cells, and blood basophils. It is stored along with heparin or chondroitin sulfate, 5-HT, and certain enzymes such as beta-glucuronidase, neutral proteases, dismutase, and peroxidase. Now, metabolism. Metabolized in liver and kidney also can synthesize histamine and has an influence on renal circulation. Metabolites have little or no activity and excreted by urine. Now, histidine, by the action of the histidine decarboxylates, is converted into histamine, which through minor pathway and the action of the diamine oxidase, imidazole acetic acid is formed. 2 to 3% is unchanged, and through major pathway by imidazole and methyl transferase, methyl histamine is formed, which by monoamine oxidase enzyme methyl imidazole acetic acid is formed. Processes or ways of release. Exocytic release is without cell destruction or lysis, and non-exocytic release includes mast cell lysis. The stimuli that mediate histamine release. Non-immunological release or chemical and mechanical release. It displaces histamine from heparin protein complex within cell. Morphine or tuberculin compounds may be cytotoxic and release histamine during disruption of the cell membrane by guanethidine, bradykinin, neurotensin, substance P, and somatostatin, and loss of granules from mast cells. Immunological release includes direct, which is IgE mediated, or indirect by action of the anaphylotoxins, venoms, and radiation and X-ray contrast media. Now, histamine receptors. It may be H1, 2, 3, and 4. The mechanism of action is given here, and the site includes for H1 smooth muscle, endothelium, and brain. For H2 gastric mucosa, cardiac muscle, mast cells, and brain. For H3 presynaptic brain, mesenteric plexus, and other neurons. For H4 eosinophil, neutrophil, and CD4 T cell. Now, mechanism of action. Histamine combines with the specific cellular receptors located on the cell membrane surface and exerts its biologic action. Clinical use includes no clinical application. Histamine aerosol used as a provocative test of bronchial hyperreactivity in pulmonary function laboratory. Now, pharmacological effect. It plays central role in immediate hypersensitivity and allergic response. In case of nervous tissue, it is a powerful stimulation of the sensory nerve ending, especially those mediating pain and itching, H1 causing urticarial response. In CVS, hypotension, flushing, sense of warmth and headache, reflex tachycardia and positive chronotropic action, and positive inotropic action and edema due to vasodilatation of the microcirculation, especially the post-capillary vessels may be seen. Now, in case of bronchial smooth muscle, bronchoconstriction may be seen, and in case of GIT and secretory tissue, contraction of the intestine or smooth muscle, diarrhea, increased gastric acid secretion, gastric acid and intestinal factor production, secretion of the small and large intestine increment may be seen, and there may be increase in the adrenal medullary secretion, and metabolic effect includes absence of the S3 receptor leading to increased food intake, decreased food energy expenditure, obesity, insulin resistance, and increased blood level of the insulin and leptin. Now, the Lewis triple response or the local action. Intradermal injection of the histamine causes characteristic red spot, edema, and flare response. The flush reddening is due to relaxation of the smooth muscle in the microcirculation, leading to vasodilatation and leading to reddening. Edematous wheal is due to increased permeability of capillary or venular endothelium and accumulation of the fluid. Flare is caused by action reflex. Now, adverse effects includes flushing, hypotension, tachycardia, headache, wheal, bronchoconstriction, and GIT upset. Contraindications include asthma, patient with gastric ulcer, and gastrointestinal bleeding. End of the topic.